Okay, so if you were to look at the Google Doc where we have practice questions and click on that, it will take you to a form, and that form is what I'm looking at here. Okay, it has 15 questions, and they're kind of practice questions meant for me to kind of help guide you through some of the topics. I'm not going to be teaching you or tutoring you specific topics today. What I'm going to be doing is giving you access to resources and coaching you a little bit as to how you should be studying and the big themes that are present in management of care. I'm going to be guiding you through how to think about them. All right, those bigger themes so that you know what to expect. Okay, so I'm going to start with this practice question. I'm going to do about 5 of them, and then we're going to go into some of the materials that I have for you. I'm going to read the question aloud, go through the answer choices, A, B, C, and D, and then, or E as well. And you're going to give me with a comma all that you want to apply, right? Give me the letters that you want to go for, or the numbers if you prefer. We're going to go over them though, the answers to these questions on the back end of our time together, right? And not right away, because I want to introduce to you the kind of question you're going to be dealing with, or a couple of the types of questions you'll be dealing with. All right, so let's read. The nurse is caring for a homeless client recently diagnosed with type 2 diabetes. Which actions demonstrate that the nurse is advocating for the patient? Select all that apply. All right, so A is consult a social worker to help the client apply for Medicaid. B is arrange for a family member to provide housing for the client. C is provide a list of area pharmacies that offer free or reduced priced medications. D is arrange for a follow-up appointment at a free clinic. And then E is arrange for home delivery of prepared meals. Okay, let me know in the chat your ideas about the correct answer to this question. All right, I've got a response here. Select all that apply. While you guys are thinking, I want you to know that the Next Gen NCLEX allows you to get a point for each correct answer. Did you know that? On the old NCLEX, it was all or nothing. You had to answer all, say that if there were 4, right, out of these 5 that applied, you'd have to get all 4 of them in order to get the 1 point. All right, but now on the Next Gen NCLEX, you get to get partial credit, which is a beautiful, beautiful thing, right? Now you can show what you know, and even if you don't know every little piece of it, you still get some partial credit. So I do like that. All right, so I'm going to just share the majority, right? It looks like we've got 1, 3, 4, which is the same as ACD, 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 ACD. We've got 2, 3, 4. So we know for a fact we've got 1, 3, and 4. Now we do have a few who like B and E. Let's go with the majority though. All right, keep that in mind. I'm going to keep these marked answers, and then we're going to go over them all. Hopefully we will have time. I'm going to speed us through. Hopefully we'll have time to go over them, and then we can talk a little bit of rationale. All right, but let's take another look at let's take a look at another question here. That's in the management of care category. All right, so the nurse is planning the discharge of an 80-year-old female client. Which of the following indicates the client needs to be discharged to a skilled nursing facility instead of home? All right, select all that apply. A, the client is not able to manage her activities of daily living, or her ADL or ADLs. All right. B, the client needs intensive rehabilitation after hip replacement surgery. C, the client is able to prepare simple meals by herself. There's D, the client has a complex surgical dressing change. And then finally, E, the client is afraid to go home by herself. Okay, so we're looking for those answers that indicate that the client needs to be discharged to a skilled nursing facility, or a SNF, instead of home. All right, so it's a matter of what qualifies a person for care coordination at this level. It's kind of a care coordination, care management question. All right. Time. So it's looking like as a majority, you guys are liking 1, 2, and 4. Okay. We'll go with majority, okay, on this. You guys can contemplate that. So while caring for a client after lumbar spine surgery, okay, which action can the nurse on the ortho spine unit delegate to the unlicensed assistive personnel? Okay, UAP, also known as the aide. All right, so which action can the nurse on the ortho spine unit delegate to the unlicensed assistive personnel? UAP. So is it A, all right, this is a multiple choice question. Is it A or 1, log roll the client from side to side every 2 hours? Or is it 2 or B, check the client's ability to plantar and dorsiflex the foot? C, determine the client's readiness to ambulate? Or D, ask about pain control with the patient controlled analgesia or PCA. Ask about pain control with the PCA. All right. So Melissa's still thinking that this is a select all that apply. And look, let me give you an easy way, Melissa. If you see the squares, it's select all that apply. If you see the circles, it's automatically multiple choice, because the circles only allow you to make one choice. So you would notice, I'm sure, if you were taking the test, that if you tried to pick more than the 1, looks like the majority like A, as do you, Melissa. If you tried to pick 1 and then maybe try to add another, it would unselect the one you chose, and that's when you would see that. But just in case you didn't notice that, the squares are always select all that apply, right? Even if you see them in a matrix or with multiple columns, all right? And the circular dial, they're called the radial dial. Those are always one single choice that you can make from the list. Okay, looks like most of you, though, are liking A. We're going to go with A. Okay, next one. We're just going to do 5 of these 15. See if we can squeeze another 5 in at the end. The nurse receives reports on the following 4 clients. I really like this one. Which client should the nurse see first? Which client should this nurse see first? We're going to talk about first questions when we get into our little breakdown. But let's see what you guys think. A client with acute urinary retention who has orders to insert an indwelling catheter. B, a client with a stage 3 pressure ulcer who is due for a scheduled dressing change. C, or 3, a client who had a hysterectomy performed 12 hours ago and is nauseous. And then finally, D, or 4, a client who had an above-the-knee amputation and has a temperature of 101.3 degrees Fahrenheit. All right, so which of the following? Okay, you guys are liking 4. The 4s are rolling in, so we're going to go with 4. All right. Next one, here's another first question, because guys, these are the ones you got to get right. These are the ones that are going to have a high point value or have a higher level of difficulty. And those are the ones you're going to want to get correct, because when you get these correct, you go higher in the algorithm. All right. You show what you know in so many different areas because of the levels of difficulty. So first, the nurse is reviewing vital signs documented in the electronic health record for a group of clients. Based on this data, which client should the nurse see first? You notice that bold lettering there is always a clue. It's always a clue from NCLEX. So A client diagnosed with atrial fibrillation who has a heart rate of 110 beats per minute. B, or 2, a client diagnosed with mitral valve insufficiency who has a blood pressure of 152/88. C, or 3, a client diagnosed with infective endocarditis who has a temperature of 101.8 degrees Fahrenheit or 39 degrees Celsius. And then finally, D, or 4, a client diagnosed with heart failure who has an SpO2 of 82%. SpO2 is also known as pulse oximetry reading. All right, so A, B, C, or D, 1, 2, 3, or 4. Which client should you see first? Okay, all you've got are these vital signs here. Vital signs are so important on the NCLEX, guys. A lot of times nurses are looking for these huge complex questions on the NCLEX, but most of the time you're going to have questions that are asking you to look at the vital signs data and give some information about what is important to do for this client. So becoming familiar with vital signs, not just knowing the upper and lower limits of them, but more importantly, knowing, given the patient's situation, what's most important for you to do first, or how to prioritize, given certain diagnoses, or which actions you want to act on faster than others. It's a skill that you should obtain in order to take this test. And it also is a skill you'll want to have as a nurse, particularly if you're in an acute care setting. All right, so it's looking like a couple of you are liking 4, so we're going with 4. All right, so that's 1, 2, 3, 4, 5. All right, so put a pin in this. All right, we're going to now make a move over to today's slides or today's Google doc. Okay, so we took a look here at the practice questions, but I want to take us back to the Canvas slide so we can talk a little bit about what this management of care is all about. And I want you to have in the back of your mind the practice questions we just did. I want to talk to you about the actual NCSBN, or National Council of State Boards of Nursing, the test plan. All right, the NCSBN is the maker of the NCLEX, along with Pearson VUE. NCSBN developed the questions, they developed the structure for the NCLEX exam. Okay, so I do want you to be able to know from the horse's mouth, right, as we older folks say, exactly how these questions are going to show up for you and what themes you can determine. So let's just take a quick look at the highlights. Now, if you click here, it will take you to the NCSBN website. So let's do that so I can show you how that happens. It's the actual test plan itself. So it wasn't the website, it's from the website, but this is the 59-page NCLEX-RN test plan. Now, management of care is a category only for RN, so that's why I share with you the RN test plan here. Okay, so if you haven't taken a look at this 59-page document, use that link in the Canvas slides to get to that document. All right, use that link to get to that document. Now, I'm not going to spend a whole lot of time, especially because we lost a little bit of time on that front end. I'm not going to spend a whole lot of time giving you a lecture on how to use the NCSBN to explore the test plan. But there is a link here, a hyperlink to a lecture that I give as a part of another course that I present, an 8-session NCLEX prep course that I have. And I've just pulled out the lecture here so that you could take a look at it. It's a 30-minute lecture. It's on YouTube. All right. And I just ask that you check that out if you're interested in knowing more about the test plan, right? It explains the test plan with all the details. I'm going to show you some of these slides today, but I don't want to miss out on the opportunity to go over more practice questions with you. So if you want to know everything that I would like to share with you about this test plan, check out this unlisted video on YouTube. Okay, go ahead and subscribe to my channel too, so that any new information that comes out, you'll have access to. Okay, with that said, check out the lecture, but let me give you the quick highlights. Okay, with the management of care category, it's one of 8 categories that you're going to be tested on the NCLEX. The management of care category, the main highlights involve, let's see if we can zoom in just a little bit closer here so you guys can see pretty well. All right, so what are the highlights of management of care? One of the 8 areas on the NCLEX. All right, well, it's going to be delegation. We've already seen a delegation practice question in the group of questions that I had for you, right? You wanted to know, which of these following actions can be delegated to a UAP. All right, so delegation and supervision of the care of the client. All right. It will also include initiating, evaluating, and updating the client's plan of care. All right. So who's going to be doing the planning? The RN, right? The PN doesn't do any planning. Generally, the PNs will facilitate or assist the RN with planning. So that's an important thing to know as well, that because that is the primary job of the RN, planning care, right? That you have to know certain parameters around the client's condition, patient status, patient history, everything that's in the electronic medical record. You have to know quite a bit about your patient in order to be able to make decisions around the plan of care. Okay. Collaborate with multidisciplinary team members. All right. So collaborating with the physical therapist, the social worker, the nutritionist. Notice before when we had that question around the patient who's going to be discharged to a SNF or a skilled care or skilled nursing facility, that is a collaborative duty. Okay. And you're working with multidisciplinary team members on the care coordination team. All right. This next bullet is manage conflict among clients and healthcare staff. Okay, manage conflict among clients and healthcare staff. All right, then we have used approved terminology when documenting care. And then there's prioritizing the delivery of patient client care based on acuity. Okay, that's a big word there. Okay, Sybil, I gotcha. Thanks so much. All right, then we have receive, verify, and implement healthcare provider orders. And then finally, these aren't all the highlights. I'm sorry, these aren't all the bulleted items that you'll see on the NCLEX test plan for the RN, but these are the highlights. These are the main highlights that we're going to go over today. All right. So if you want to know more, I'm just reducing the size of this, go to the link to the lecture. Okay. I'm going to finish out the hour just making another quick set of notes around or bring to your attention another quick few pointers about this actual test plan. Okay. And I wanted to focus in on, if I can make this screen larger again. All right. The 8 sections that you're going to be judged on the NCLEX. Okay. And these 8 sections, as you see here by their percentage distributions, include at the very top for RNs, management of care. All right. There's also safety and infection control, health promotion and maintenance, psychosocial integrity, and then the 4 categories that fall under physiological integrity, which includes basic care and comfort, pharmacological and parenteral therapies, meaning the IV drugs are the domain and the scope of practice of the RN, reduction of risk potential, and physiological adaptation. All right. So management of care, though, look at how much it's one of the largest percentages, right? That you could get anywhere from 15% to 21%, pretty much the largest category. And I think that's because a lot of the questions that fall under management of care, you might also see in pharmacological and parenteral therapies or reduction of risk potential or even physiologic adaptation, because it's really about those priority questions, the questions that have the bold lettering priority in them, and also those questions that have the word first in them. All right. So the first and priority questions fall under management of care and those other physiologic integrity style questions. So that's why this is such an important category for us to spend our time working on. All right. So again, check out the video to get a little bit more on this slide as well as this slide. Just quickly though, this is a word cloud that shows you, when going through that test plan, which words show up the most often when you're talking about management of care. So it's all planning, right? Assessing, conflict resolution, managing the patient's care. The larger the word, the more often you're going to see that word associated with this category, okay? Evaluating, acuity, right? Supervising. So there's a lot there, and I have a word cloud for each of the 8 sections. So if you look at the test plan video there, you'll see how those words might differ for each of the 8 categories. All right, here's where I want to show you what a candidate report looks like. All right, so if you've never taken the NCLEX, and then you won't know what this is. Now, if you've taken the NCLEX and not been successful, you do know what this is. Okay, so this is the report that people who are not successful with the NCLEX get. All right, when you pass the NCLEX, usually they don't tell you where you were near the passing standard or below the passing standard. It's assumed that you were above the passing standard for each of the 8 areas. So I don't know that you knew that, but it is important to reiterate that in order to pass the NCLEX, you must be above the passing standard on all 8 of those client need areas that you're being graded or scored on. Okay, so management of care is right at the top. Now, if I zoom into this just a little bit more, this candidate report, right, it's going to tell you which of the particular areas you were near or below the passing standard on, but they're also going to show you for each of the categories a bulleted list of relevant topics inside of that category, right? So you're going to think, oh, this must have been all the stuff that I got wrong, right? But honestly, this is just a relisting of all of the details that were included in that NCLEX-RN test plan that I showed you before. Okay, so all they did was, and if I can scroll down here a little bit more and take you to the 8 client need areas, right? Let's just pick management of care. Here we are. I clicked on the table of contents and it dropped me down to this looks like page 7. Okay, so here's the full bulleted list of all that you could be potentially tested on as it relates to management of care. I just went through a brief highlight of this list here earlier. But what you're going to see, I'm going to go back to our candidate report. What you're going to see on this candidate report is the same bulleted list, right? It's just going to tell you all the stuff they told you in the actual test plan document. All right, so it pays to check that document out before you get into the test, right? Because you don't want to find out on the back end that they're just going to point you right back to that test plan in order to see which topics are fair game, okay? So with that said, if you've gotten one of these and you tried to crack the code on what you need to do more of in order to pass the test the next time around, don't get frustrated, okay? Because these aren't very helpful at all. All they tell you is where you were near or below. But guess what? On the next version of the exam, you will not see any of the questions that you've ever seen before. The exam has a way of keeping up with all the ones you've ever done, all right? And it has a pool of 5,000 potential questions. So you've got plenty more unseen questions that you could continue to take until you eventually pass the NCLEX. So with that said, it doesn't really help you to go, oh, well, I'm going to go and study harder on all the areas where I was below the passing standard and not so hard on the ones where I was near. Nope. Just throw the whole form away, right? And then just start over studying each of the categories, all right, by looking at the topics that will be covered, right? And making sure that you have an understanding as RN candidates of at least 52% of the material that you study, all right? Because those are the passing standards for the NCLEX for an RN. You only need to know 52% of the content that you see on the day of the NCLEX, right? Only just a little bit more than half, all right? Because they're testing you against all kinds of nurse candidates from all over the country and even in other countries. And they only need to know that you are operating at a level of safety that's pretty average for a nurse who's completed an accredited nursing program. All right, so here's where I would talk to you more about the NCLEX question types, but hey, I have a link to a lecture here that will take you out to a YouTube video where I would describe all of these old gen question types, right? And then also the next gen question types, and kind of give you some details as to how they're scored and all the differences and the updates and the nuances to the 2023 version of the NCLEX. All right. But again, in the interest of time, I'm just going to let you know that there is a link to that lecture. You are welcome to check it out. Okay. All right. So here's another one with the link to the lecture, right? I want to be in the interest of time here today. So I'm sharing the other content from the other course materials that I use. So this is an elaborate little schematic here, and I don't mean to traumatize you by just showing you this schematic out of the blue, but it is the pathway used to grade NCLEX questions. Okay, clinical judgment is what they're measuring in the NCLEX, clinical judgment. And if I can just quickly go through this schematic, know that there's a whole lecture here, it's only 30 minutes, describing to you what this model means and how you get your grade. It's really helpful for case studies, right? Because case studies are the new level or layer 3 here, where we're going to be examining the nursing process by way of these 6 case study questions. You can get 3 of them at a minimum. And I can guarantee you that someone here will see case study questions that are asking them which particular assessment finding they want to evaluate first, or which particular client out of a list of clients they want to assess first. All right, so those first questions are going to come up in those case studies. So will the priority questions that will come up. To know more about those, you were going to look at the question types lecture that I shared with you. It will kind of give you some detail as to how those first and priority questions show up. All right. But that said, case studies are what this whole clinical judgment model is about. And I want you to become good at them, but it really helps to kind of understand what the model is going for. All right. So with those 8 client need areas that we were talking about, today's client need area that we're focusing on is management of care. You're going to make a clinical decision based on your clinical judgment. And if that the judgment isn't based on these satisfied criteria here, you have to satisfy these criteria. You have to form a hypothesis. You have to walk into the patient's room, realize what's happening to the patient, recognize cues, analyze those cues, right? And then you have to iteratively refine your thoughts about what's going on with this patient, set a priority, okay? And then you're going to generate a solution, all right? And I don't know if you noticed, but these colors here map over the colors here in the nursing process, which we're all trained on, okay? We're all trained in the assessment, diagnosis, or analysis for the sake of NCSBN. They don't like to use the word diagnosis for RNs in NCSBN because they reserve that for the nurse practitioners and the physicians as healthcare providers who will diagnose. All right. So we'll use the word analysis instead of diagnosis for those of us who are used to ADPI with assessment, diagnosis. There's the P, planning. There's the I, implementation, and then the final E, evaluation, ADPI. All right, well, notice the colors overlap with the 6 question case study, or the 6-part case study process, iterative process that's going on here. All right, so if you didn't know, the case studies are very predictable. They should be, as long as you know and understand all of the disease processes you could be tested on, then these 6-part questions, people are telling me, are much more straightforward, much easier to take than, single, standalone, select all that apply questions, for example. Okay, so I'm not going to spend any more time on that. I wanted to have this piece kind of finished by the top of the hour. But there's more in clinical judgment here and the 6 steps involved in that. They can be broken down to this mnemonic RAPGTE, RAPGTE. Check out the video for more.